everyone, I'm Carey Pena, and this is a Good Morning Sunshine Mindful Moment. With us in studio today is Dr. Connor Bohr, the founder of Neuroactive Spine and Rehab Center. Thank you so much for being here.
Thank you for having me. I'm very excited to be here.
We have been hearing so much about you. Your offices are very close to our studios, and you have people flying in from all across the country, in fact, all over the world to come and see you. So I want to delve into what you're doing at your practice that's different.
Absolutely, I'm excited to share.
You take a three-pronged approach. What is that?
So our three-prong approach is a little bit different than kind of the standard, I guess you could call it allopathic care that a lot of people get. With that being said, we do co-manage with a lot of the medical world as well, closely with a lot of neurologists, OT, PT, speech, so on and so forth. But our approach is just a little bit different. So our three-prong approach takes into account the body, the brain, and your biochemistry. So the body kind of dives into a little bit more of the chiropractic work that we do. The better one feels their body, the better their brain can kind of coordinate everything, if you would. And we see a lot of people with musculoskeletal issues as well, everything from chronic pain to post-stroke. So as we go through and work on our body, we're able to manage a lot of different cases that maybe standard OT and PT can't really dive through, just because we take a little bit bigger of approach with that, with introducing our other two prongs with the body. So our second prong, and probably our most prominent prong, if you would, is the brain. So with all of our patients, we start by doing our big initial assessment. We do a very detailed history. We do a big examination, physical examination, neuro examination, all our diagnostics. And our job is to figure out where in the brain is there an issue. Is it in the cerebellum? Is it in the basal ganglia? Is it somewhere in the spinal cord? Is it in the brainstem? So from our history and from our diagnostics, we're able to isolate those parts of the brain that is causing symptoms in certain patients. So once we're able to do that, we're able to make a very, very specific care plan for that patient. So the stronger we make that patient's brain, the better that their symptoms really subside after that. And that's I think the amazing part about what we do is that it's so specific for every patient. Now, of course, we see certain patterns, but if we see 10 people with a brain injury, for example, all 10 are going to have a little bit different of a care plan when we work with the nervous system.
And then your third prong is the biochemistry.
Yes, so the biochemistry plays a huge role, and this is something that a lot of people recognize, but not too many people dive into much. And that is looking at all of our metabolic systems. So to understand this a little bit better, we run different lab tests. We draw blood, we do urine tests, and that gives us a better look into how all the different systems in the body are working. So we could do everything from our standard blood tests, like our CBC, our CMP, more of the standard medical labs, which led us into a lot of very valuable information. But we could also dive into more advanced lab testing, such as organic acid testing, looking at different gut panels, so on and so forth. And once we have some of those questions answered with the labs, we're able to recommend certain recommend certain diets that would benefit them. We're able to recommend certain supplementation. And the stronger that we make the cells of the body, the neurons of the body, the better that they'll be able to react to the therapies that we're doing as well.
What role does the gut play? I know it's a really big deal.
So the gut plays just a huge role. There's a gut-brain axis, but there's also a brain-gut axis. So a lot of things that interact with our stomach will affect our brain one way or another. The biggest way probably with inflammation, and I know that's a very, very hot topic nowadays. And we're able to use a lot of tools even outside of supplementation to help downregulate that inflammation as well. I would say probably the most novel tool that we use that a lot of people ask about on social media is our low-level laser. Our lasers are made by Erconia. We trust them the most. They're our favorite laser. And we're able to use this laser over certain parts of the brain and body to do everything from decrease inflammation, increase energy output in the areas that we have it over, increase blood flow, increase something called brain-derived neurotrophic factor, which is the protein that helps create neuroplasticity. And at the end of the day, neuroplasticity is the best way for us to make all the gains that we want to do. So
opening up the neural pathways.
Exactly. So our job essentially is to connect certain pathways in the brain to make them more efficient. So how do you learn how to ride a bike? You connect those pathways. How does someone learn how to use their right arm again? You connect pathways. How does somebody become less impulsive? You build those pathways.
So you treat folks, or you work with folks, I should say, that have everything from developmental delays, brain injuries, stroke survivors, dizziness, migraines. I know a beautiful mom came to us, contacted us, and said that we need to get in touch with you and talk to you because she feels that you helped save her daughter. Her daughter is a near drowning survivor, little Eviana. Can you tell us just briefly what you did with her daughter? That Melissa, the mom, told us when you started working with her, her daughter changed.
Right, yeah, no, Eviana, we've been working with her for a little over a year now. She lights up the office. Every one of the staff absolutely loves her. And yeah, we've been able to make some pretty awesome gains with Eviana.
What do you think you're doing differently?
Again, I think it's really working on this three-pronged approach. We're working on her body. She has some physical deficits that we're able to work through with some of our musculoskeletal therapy. We're working on her brain. Obviously, with her injury, the origin of it is a brain injury. And when we come around the back end with the biochemistry and the metabolic side, we're able to put that brain in such a good condition that we're able to make those connections happen that much more efficiently.
Plus, I understand that you have such a personal approach, and in medicine these days, that is something that people really appreciate. You take time with your clients and you really try to get to know them.
Absolutely.
And your practice is already booming only 9 months in.
One thing that I wanted to make sure I did as I'm opening up and as I'm growing my practice is really to have that personal care with the patient. So I'm never rushing anyone along. I take time to answer all their questions because personally I know when I go to the doctor and I'm in and out of a room in 2 to 3 minutes, it definitely can help, but there's sometimes a little bit more that we have to dive into. And a lot of the cases that we see are quite complex patients, so it takes a complex approach to work with them, and it takes a good amount of time to work through a lot of these cases as well. So I thoroughly enjoy spending all the time I do with the patients because it helps me narrow into the right approach that we want to go right from the get-go instead of running around circles for a handful of months. So we're able to hone in our treatment plan the best that we can that way.
And I know this is a generic question and you deal with a variety of ailments, but just leaving people with one piece of advice, you're focusing on a mind-body connection. What do you want people to think about and take away?
I would say the world that we're living in, unfortunately, is changing. It's not the same world that we grew up in. With everything from the food that we eat to things that we see on social media to everything on the internet to video games, especially with some of the kiddos, is you have to remember that as your brain is growing and developing, you want and need proper adjuncts, I guess you could say, to help supplement a growing brain. And that includes being physically active, being mindful of what information you're putting into a kid's brain, being mindful of the food that they're eating, making sure it's not all junk food and sugar and these pro-inflammatory foods. So I always tell people if it's been around before the 1950s, you're probably good to do it. Go play outside, go knock on people's doors, go ride your bikes around, eat your fruit, eat your vegetables, eat good meat, and that's setting your brain up for a good growth of progression of development.
I like that. Go knock on people's doors. I saw a comedian did a skit about it, and it was so funny because he heard a knock on the door, and everyone in his family dropped to the ground. They're like, "Who's at the door?" No one announced that they were coming because we're so not used to people just stopping by anymore. But we certainly appreciate you coming by the studio. Dr. Conor Boer, where can people find out more?
You can follow me on Instagram, Dr. Conor Boer. I'm on Instagram. We have a TikTok page and also on Facebook, all Dr. Conor Boer. Our practice, as you alluded to earlier, is Neuroactive Spine and Rehab Center. The website is neuroactivecenter.com, but if you just search my name, I'll most likely just pop up.
Thank you so much. You're doing great work, and you know, it's obviously showing up because you're so busy already because you're taking this very caring approach. So I really appreciate all the work you're doing. And thanks to all of you for listening and watching Good Morning Sunshine. Be sure to subscribe to our YouTube page and follow along with myself and my co-host Brandon Lee. Thanks so much, everyone. Take good care.